Welcome to Lessons in Rural Community Engagement, a conversation series with Chelsey Patriss and Rosa Fernandez of the Health Equity Partnership of North Central Massachusetts.
So we're talking about designing engaging events for equity and accessibility. And really for these organizations really to recognize their cultural blind spots. And so that's why it's so important that this is always a continuous learning.
When you have a large rural region, they don't identify, with the opposite end of your region, right? So like we've kind of always said, if you hold something in for us it's Fitchburg, you're not going to get people from Barry to come to an event in Fitchburg. Not necessarily because it's too far, but because they don't identify with that community. So even if you say it's a regional thing, they don't identify with that. So there was that, geographic equity of going to our subregions instead of expecting them to kind of come to one centralized location. We also had some Zoom meetings. So and we had meetings at different times. So we had a couple of those that were on weekends during a time when the host organization said that it would be good for them to, be able to bring people in. We had a couple of evening meetings. Again, this was all determined by the host organization and what they felt their clientele was going to be able to come and do.
And when designing these events, we also learn to have those materials in multiple languages, or in large fonts.
Oh boy, did we learn. We had the experience of really trying to reach out in more equitable ways and be more accessible. And there were times when we fell short. Like we did an entire focus group in Spanish, and that was something we had never done before. So it was, a huge leap forward in terms of accessibility, right? And having something presented in people's own language. But some of the material, printed material anyway, hadn't been translated. So while we had a facilitator who was facilitating in their language, the written material didn't always match it. Some of it did and some of it didn't. And so it was.
And we had all the greatest intention.
Mm-hmm.
We were like, where are we crossing all our T's and dotting all of our I's and making sure that we come into these spaces and giving them all the tools and the resources so they could participate in a more thoughtful manner. And while we were trying to do this with great intentions, like to your point, was that we kind of fell a little bit short. But not to take it as geez, we didn't put thoughtful attention to process, but to take it as a learning experience. So when we do it a second time, so it's like you want to evaluate your work. So you want to know what you did right, what you did wrong, what areas you can improve. And so that was, for us, it was a learning under, although we had a facilitator who facilitated in Spanish, and not making sure that now the second time around we're even more prepared when we're delivering or designing these events to engage and be more inclusive of our community.
Right. And I think that was the biggest takeaway, right? Was that we learned from it and we grew and we have changed and adapted and done new things. And one of the things that came out of that was that we now have an entire advisory group that is meeting, that is facilitated in Spanish and convenes their entire group in Spanish, which is so needed because really when we just tried to do one event, right, and say like, okay, we're going to do this event in Spanish because we want it to be accessible. Well, that was only an accessible event. It didn't make all of our other engagement activities and all of our processes and all of our other spaces accessible to them. So if we had left it that way, it would have been more extractive because there really wouldn't have been a way to kind of come back and close the loop and draw people into an authentic long-term engagement experience. Everybody's afraid to do equity work wrong, right? But the most wrong you can get it is to not do it, right? So it's better to do something in that direction and take the lumps and let people tell you that you did it wrong and, good try, but you need to do better, and to continually do better. Because I think if we had really said, how can we design the perfect experience for Spanish speakers, we would still be here today talking about it, and we wouldn't have done it at all last year. We would have said we really wanted to, but we weren't ready. And we stumbled, and it was messy, and it was so far from perfect, but it happened, and it generated enough interest from enough people who wanted to keep it going that we now have this growing group of people who are really excited to be involved in the work.
And the great thing about that, we don't have to manage it, It's something that's growing, and eventually the group themselves sustain it. And then they feel a part of that. Talk about engagement, they feel a part of those solutions that these organizations are trying to solve.
When we go out into a community meeting, right, and we meet people for the very first time, and they see some of the stuff that we've done, and they get the little, annual report of all the things we did the last year, and they're like excited, right, about like, how do I get involved in this? And we don't usually have like a immediate, like, next week you can do this, and that's how you're going to get involved. We don't have a center that they're going to come and volunteer at every couple of weeks or something. So the only real way that we can say we're going to keep you informed and involved is to immediately say we're going to add you to our mailing list, and you're going to be on this, so you can feel like you're staying connected and involved.
Right.
And then you have, the website and the ability to email us, and, we're responsive. So there's that kind of.
And we host, there's a lot of hosting of that relationship building. And I think that once we have a relationship with them, they're more in tune to want to be proactive and participating in whatever is being sent out in those newsletters. So building those trusting relationships is key to having them more receptive to any publications that we send out. So when they see something that says Health Equity Partnership, they're more in tune to open it because they know who are the drivers behind the organization, who are the leaders behind that organization. So that's why it's very imperative, that relationship, because if you want them to stay involved or connected, that relationship has to be built.
Yep. Well, I remember when we were designing the charrettes, and one of the things that we said was, hey, if you need transportation or childcare or translation or anything, let us know. And there were a couple of people who we were almost going to have to like pick up and drive there because there was no transportation. And so, accessibility, it's part of it is, what are you promising? And some of it is being realistic about, what you can deliver, what your budget is. I mean,
really know your community. That's why it's so important to understand who your community members are, because then you could address at least a minimum.
Mm-hmm.
So to address the needs of your community, because it might be different for every community. Maybe there's a large Haitian population in one community, but not Spanish speakers. And so why have your materials all in Spanish, thinking that, so really assessing your community is imperative when it comes to engaging your community.
Mm-hmm.
You need to know who's there.
Yeah. And I think we've kind of harped on this a little bit, but just not expecting it to be perfect and being humble about that, and being willing to kind of roll with whatever is happening. I mean, when we went to do, I'm thinking of one particular charrette where it was not only Spanish speakers. We had accommodations for Spanish speakers, but we also had people who only spoke French, and we also had people who only spoke Portuguese. And I think there was another language too in there that
Haitian Creole.
in Haitian Creole. So we had like 3 other languages besides Spanish that we did not really have accommodations for, and they made it work. There were, participants were interpreting for one another, and we had to kind of adapt on the fly because there were things that it was a pretty complicated process that we were trying to get through. And to slow it down enough for someone to do interpreting while we were trying to get through this activity. And as you've said before, it's not just translating the words, it's also translating the concepts, because some of them are pretty heavy, like equity concepts that not everybody might understand. So when we talk about the food system, what does that even mean? Or when we say equity versus equality, or racial justice, that doesn't, we might think everybody knows what that means, and it does not mean the same thing to somebody who's come from a different country.
People are the best advocates within their own communities. For that individual who couldn't get to the event, that individual started researching within their own community why we don't have a transportation. I can't get to this event because it allowed the community member to have a voice in their own community, because now this individual's feeling frustrated that couldn't participate in a process because the community didn't have transportation offered.
So yeah, sometimes community engagement surfaces problems, whether it's within your own organization or within the municipality, or the engagement didn't go the way that you wanted it to go, or way that the person, the community wanted it to go. But as long as it planted that seed and generated some kind of momentum in either in you to change, right, in your organization and to grow, or in the community and that community member to change something, you won, right? Like, that's what community engagement is.
Yeah.
So even if you didn't get the result you were expecting, something happened, and that is community engagement.
Right.
It's organic. It's not gonna be what you expect.
And also the relationship was built, because now that community member said, now we have a friendship here. You as an organization stood and listened to the challenges that I face as an individual in the community, and you also gave the opportunity, at least from your understanding and your expertise, you could share some resources, maybe convene with other groups where they're addressing that issue, and you could kind of make that connection too. So
Thank you for listening to this episode of Lessons in Rural Community Engagement with the Health Equity Partnership of North Central Massachusetts, and paid for by a grant from the Massachusetts Department of Public Health through the New England Rural Health Association.